Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome to our weekly podcast, Redefining Medicine. We are happy to welcome back to the podcast Dr. Paul Anderson, a naturopathic medical doctor, educator, and recognized authority in the field of integrative cancer research and the treatment of chronic diseases, genomic conditions, and autoimmune and infectious disorders. Welcome back, Dr. Anderson.
Thank you for having me.
Great, let's get started. You spoke with us on a podcast in 2018 about your journey to practicing medicine and your integrative clinical practice. Will you provide us with an update on your clinical practice and your research?
Sure. Since 2018, obviously the whole world has gone through a lot. A lot has changed. A lot of new and exciting things have happened too. And in my world in particular, there's been a lot of, our normal work with cancer and chronic illness, but also a lot of additional work in the world of infectious disease and IV therapies, such as we talk about in these courses. One particular area, because of my background with using intravenous vitamin C with cancer patients, et cetera, has been working on programs for intravenous vitamin C in hospitals for patients with COVID and other infectious diseases. So in addition to the base and the core work with the chronically ill, that's been a big addition that has been very challenging actually, but very rewarding as well. So the practice, the research, the writing, all that is just moving forward.
Have there been any particular new findings, tools, or other updates that have made a significant impact on your clinical care approach?
I think the way I look at that as far as new findings or updates, et cetera, is more an evolution of an idea that I've always had and I've always used clinically, but in the last 5 years, I think it's really sped up. And that's the idea of therapeutic synergy. So therapeutic synergy using multiple modalities and multiple ways into the clinical case at the same time to try and drive the case forward in a positive way really has not only borne out to be, as it's logically true, but also clinically true. But the other side of it that we see is it allows more flexibility clinically. It also allows patients sometimes the ability to use less of a modality that might be quite costly, but still get the same amount of benefit because you're doing other things to be supportive. So I really think looking at clinical synergy and incorporating has probably been the biggest thing that's moved forward for us.
You will be leading several sessions at the upcoming IV therapy symposium being held this September. Will you provide us with a preview on these various sessions?
Sure. It's going to be a real busy couple of days for all of us who are instructing there. It's a really great lineup and great topics. The topics I have break down into a couple of topical areas. One is more what I would say the technical aspects of intravenous therapy in the outpatient setting. And that includes everything from your appropriate calculations and documentation and regulatory things to keep you out of trouble, but also to do so you're following best practices, appropriate monitoring with laboratory tests for your patients, but also some really wonderful kind of where the rubber meets the road type of clinical material, such as how to put together effective IV protocols so that you can use the very best of vitamin and mineral and amino acid mixtures. What's the best way to decide what formula works best for your patient and how to put them together. The other thing that we're going to be talking about is timing of therapies, which is very important. If you are less experienced with IV therapy, sometimes you'll see a formula and wonder, well, should I do that once, or do I do it, 3 times, or should I do it for a number of weeks or not? So we're going to try and weave in a lot of that clinical expertise along with just the idea of having a formula. And then the last portion is sometimes the least desired information, but very necessary to keep us all on track and out of trouble. And that's the regulatory environment from the top down, meaning from the federal government down through state government, and how to have your policies, procedures, how to have your intravenous mixing and all of those things done in a way that keeps you in as much compliance as possible, because there's been a lot of changes in the last few years around compliance from the federal government.
Is there one particular session you are most looking forward to speaking on? And if so, will you explain why?
That's like, which of my kids do I like the best? I'm excited to do all of the sessions I'm doing. They all have very unique aspects that they're going to bring. But I think that the one, although it's always a more difficult discussion, the one that I'm really very interested and excited to bring is the regulatory environment changes, not because it's maybe always the best news when we have regulatory changes, but it's incumbent upon us as physicians to make sure that we stay up to date with these changes and don't get ourselves inadvertently in trouble. Most of these regulatory changes have less to do with your ability to provide patient care. And so the other sections I'm doing really are more about that, the direct doctor to patient activity. But the regulatory things are important because the federal government and then the state governments working with the federal government have different interpretations of rules that we've all followed for decades in one direction. They want to change them in other directions, and it's important that we're aware of those. So I'm excited to bring that new information, whether it's whether it's a happy news, sad news, or whatever, but mostly because the goal of that is to keep all of us out of trouble and keep us in compliance. So I'm looking forward to that.
Dr. Anderson, what gaps in education and other roadblocks do you see, particularly within the field of oncology?
And I think this hasn't changed, but especially with integrative oncology or oncology in general, it's such a fast-moving area of medicine where we have this avalanche of new information daily, and we have some of the most rapidly developing classes of drugs, of biologic drugs, that are largely focused at oncology. So we have new drugs coming into the picture all the time, new therapies. And then you add to that the fact that our standard of care in traditional oncology evolves like every other standard of care. But sometimes the refinements are better, but they come pretty fast. So I think in the world of integrative oncology, it's dealing with that fast-moving avalanche of data, and then finding a way from the integrative point of view to make sure that we're not only doing the very best we can for those patients and putting our information together well, but also realizing that many of the things that we do in integrative oncology are going to be supportive no matter how the medical or surgical oncology world changes. And so I think that's really if you're looking at gaps and places where I have to step back periodically and say, okay, I used to know a lot about that in this particular area of oncology, and now the playing field has changed. We've got a bunch of new drugs, bunch of new treatment protocols. How does that change what I do with my patients? So I really think that's the big area there that we all need to pay attention to.
Do you see yourself as an advocate for this style of medicine? And if so, what activities have you participated in this field to promote it?
I do. I don't know that I always felt like I was an advocate because I was more of a teacher and a clinician, but I think the ways that I advocate are in a couple of strata. One is teaching is advocacy, because if only one doctor knows something, it's great for their patients, but it doesn't help the larger group of patients. So I feel teaching is a way to reach out and, help to spread correct information and help us move forward. The other thing, especially in the last decade, that I've been doing a lot is a lot of writing in the world of IV therapy, but also integrative therapies in oncology and other chronic illnesses. And, most all of that writing is in the public domain. So it's, again, an extension of my teaching. And then the final advocacy, which I tried to avoid for my whole career, but I've been doing a lot of the last about 8 years, is government advocacy. So I do a lot of work on FDA interface between the type of medicine that we need in integrative medicine and the type of access to medicine that we would like through compounding pharmacies, et cetera. A lot of work with their oversight boards that are really trying to change our access. And then there's other government advocacy as well. So that's the newest addition, is the government end.
Dr. Anderson, what advice do you have for someone who is looking to find an integrative oncologist?
That's a really good question, and it can be frustrating for people because, for example, many people who are dealing with cancer are probably in the standard medical system. And if you're in a real large metropolitan area, your system may actually have access to integrative oncology providers. The thing that I have seen, though, is that tends to be very specific to particular hospital systems, and also, like I say, tends to be in very large cities. Many people don't have access to those. So if you're not given the option of somebody on your team already who's an integrative oncology practitioner, the next thing to do is to search in your location, obviously, if possible, and look for people who have done extra or fellowship training or have other training certification in integrative oncology. Now, normally, to narrow that down, because if you just put in, say, your city and integrative oncology in a search, you might find some really great resources or people, and you might come up with all sorts of other things because the search is kind of non-specific. But what I normally have people do is look at a couple of locations to look for physicians, and then look for who is in your area. So the first would be through A4M. The A4M website has a directory of physicians. Now, this is not segregated to oncology versus, say, chronic illness versus other things, but at least it narrows it down to people in the integrative medical space. And then you can search and you can look for who's in your location, area, etc. And then what I always tell people to do is first just do a cursory look at each physician's website, and that will usually say right away if the integrative oncology is part of what they do. There's another website as well that we use a lot, and this one is also, there's a lot of crossover between the A4M website and this one, but this one is focused on oncology, and it's oncanp.org, OnCamp, OnCamp.org. And that will have a directory as well. Again, then you want to look at who's in your location and area, and then go from there. Now, I will say, with the advent of COVID and a lot of telemedicine, a lot of integrative oncology now is being done by telemedicine. And if you, for instance, don't need to go to a clinic to get a particular service, there's also that available, but that's usually pretty clearly spelled out on the websites as well.
Thank you so much, Dr. Anderson, for sharing your time with us today. It has been an absolute pleasure to have you on the podcast.
Thank you.